what is
Hmm.
happening in nowadays is patients are actively looking for options for finding a physician or finding cheaper medications, for example, or a way to pay for their procedures. They are actively looking. And that's why you see all these huge companies like Amazon and the independent pharmacies like Mark Cuban Pharmacy. They are showing up because they know there is a huge interest towards cash pay.
Yeah, and when everything gets all stirred up like it is now, that's when all these opportunities come about, and that's where things like direct care I see as big time expansion potential as all this stuff gets stirred up and people are going to be frustrated. The more people that are like frustrated with the system, they're looking for alternative. That's already happening, but people are still. I think a lot of people in the system or even patients are still stuck in it and don't really see another way. I'm curious when you made the jump, did a lot of your colleagues or people around you, did they give you the sideways stare and they're like, "We sure? Like, what? Explain that again."
A lot of them were confused about what I was doing, and I believe that's absolutely normal.
Yeah,
And a lot of them today are calling me to ask me, how can I do this?
and you're like, "I'm doing it."
Yes. And there are still people that are asking me, how is this possible? I never thought this is possible. And you probably, they're probably right because you don't think about options until you're really in that point, that breaking point that you want to change something. You understand that you either accept it or you should work to change things.
So how is it working? I get the feeling that you love what you do. That kind of is conveyed just from how you talk about it. And I think that's fantastic versus a lot of people in healthcare are the opposite end of the spectrum. They're not excited at all about work. But beyond that, like how is it going? Is it financially going well? Do you feel like sustainable business model in specialty care and even, more so than the traditional model? Or what are your thoughts on like the state of it at this point? It's still pretty early.
I think it's very early for me to take conclusion or draw conclusions at this point. What I can tell you is that it is working and
Mm.
it is extremely rewarding both for me as the physician and for my patients. What people that come to me will say is that they are very grateful for the time that I spend with them, for the information that I share, for the care that I give. And I can tell you that I'm sure I'm not doing anything different from what I used to do at a speed up level, that people were not having time to digest that. And I was not having enough time for my patients, that's for sure. Now, if you want to become a millionaire in the first year or the first couple of years, I don't think that is possible. And I don't want people to have that kind of expectation. It all depends what you want and how much you want to work. And it also depends where you are in your expectation, and what kind of practice do you want to build? Is it like a practice with multiple physicians? Is it a practice that it's only you? So it all depends on multiple factors. But it is doable and it is something that will bring a lot of reward on both sides.
It doesn't seem like many direct care physicians are burning out. In fact, I think they're like super jacked, but they're very excited about the work that they do, which is such an interesting. I wonder if there's a statistic on burnout among direct care physicians. I would imagine it's like zero or low or whatever.
I don't think we have statistics yet, but every single one that I talk to, they are not complaining about burnout. Every single one. Even the specialists that they are doing direct care, they will relay the same thing. Now, because you mentioned about the vibe that I send out, this is something that I'm told all the time, that my optimism is contagious and everybody that talks to me, they want to do it. And I think that it is very important to give that kind of vibe, especially when you have transitioned through that and you can tell people that it's possible to be done. And we as physicians, we lost hope. Unfortunately, we are stuck like our patients. So it is important to have this kind of community that I started to build a few years ago, where people come in, they learn about it, they ask questions, they get support also from physicians that are doing it. And I think that we as physicians, we unfortunately we lack that ability to connect and to support each other. And we should do that because
Mhm.
everybody outside of the medical system, they have their own communities that they support each other. Even the nurses, they have community that support each other. The nurse practitioners, they have a huge community that they support each other. So we as physicians, we should unite and we should help each other as well.